great tee up to process automation. Whenever I come to these type of conversations, we want to break it into a couple of different parts. One is a little bit of education. One is a little bit of what's new, and one's a little bit of demonstration, right? Show and tell is always cool for the 20 minutes we have, and there's always something new to cover. My focus here, after I do my introduction, is going to be more about some new ways of thinking about process automation and the changes we're seeing within the healthcare spectrum, and less about why should you care about RPA. We'll talk a little bit about that, but I'm sure you've seen a lot of those demonstrations. It's kind of a tired conversation. We could always get into that one-to-one and fill another 20-minute segment, but that is the purpose of the conversation today. Before I go into the agenda, my name is Jason Warrelmann. As I said, I lead the global healthcare and life practice at UiPath, which is a process automation company. We'll talk about who UiPath is at a moment, but as we kind of get into that, I'll cover a little bit about that. We'll talk about how RPA and robotic process automation, that's the acronym there, has changed in healthcare. We're going to talk about the composable health system, and that's the main topic today. A lot of the conversation, aside from security today, has been about composability in the health system, which is integrating everything together to work as a unilateral program. So we're going to talk about what that means and why this is relevant, the Better Together program that we drive and how this is really furnishing the advancement in healthcare, and then finally what I like to call RPA 2.0. So with that said, I'm going to start with some key metrics before we talk about UiPath and automation as a whole. So not my words, but McKinsey, right, estimates that $3.6 trillion of work is automatable. And when they talk about automation, I'm not talking about like the Da Vinci machines that do the surgery. I'm talking about computer-based emulation. If I can tell you that I can take the research that you do, the data entry that you do, the data aggregation that you do, the case management you might manage, and give that to the computer to do automatically, you would do it, right? It's no different than someone hiring a personal assistant or a research manager or a case manager. People do this work all day long, but you don't hire them to do that remedial task-based work. You hire them for their cognitive ability to take all that work together and give you insights so you can drive recommendations. Automation focuses on all that front end part. Ron had talked about a lot of the key features. Again, I'm sure most of you have already heard about automation, have seen it live, whether it's a platform you're driving or even within your cloud-based stack like Amazon through NLP. It could even be within your EMR driving workflows. Epic has a lot of these today. They're all considered, and I'm air quoting without you seeing me, automation today. So massive potential, and it's just scratching the surface. This quote came out at the heyday of COVID last year. But what happens after that, right? This whole point is about digital transformation and patient-engaged data post the COVID world. So before the COVID world, a lot of automation was around the digital transformation layer, but at a very tactical place. Executives are saying it's a nice to have. It's something we could think about. I just made a major EMR migration. I'm looking to the cloud. So it became very tactical in that sense, and that's fine. That's how automation really grew leaps and bounds over the 2018, 2019, early 2020 world. But after, really during COVID and then post, which is the current state, I'm sure we'll acronym it in the future. We've now seen this really magical push to full end digital transformation, which for UiPath is really what we're designed for, and I'll show you why in a moment. But now about 93% of executives say that RPA kickstarts or will kickstart their digital transformation today. 82% of them feel that they're going to accelerate their program over the next 3 years. Actually, out of that 82%, there's a good white paper that came out of Gartner that said 60% of CFOs already are focused on RPA today, while about 45 to 50% CIOs are extremely interested in how combining it with products like Amazon will really drive the next healthcare organization. 83% said they really want to bring agility into their business, and this can bring that level of resilience and quality control. The one thing that you'll find when we talk about process automation, if you have seen it in the past, it's not your grandfather's RPA, which I know is funny to say, but it really has grown over the last 20 to 30 years from being a very BPO-centric wireframe product to really a very advanced intelligent-based software. Whether it's UiPath or any other product, most of them have evolved to a very high level of resilience. It's not screen scraping. If you've heard screen scraping before, there is nothing about automation, or at least our platform, that screen scrapes today. It's a much more complex, much more algorithmic, and much more semantic in terms of looking at a screen and defining exactly what it's trying to do, just like a human would. Why is that important? And why are 83% saying it's important to resilience? Because if maintenance is low and the tendency to break is less, every time Epic sends a quarterly update, the amount of work and retraining needed for robots is that much smaller. So super important, especially in the healthcare market. And of course, from a business perspective, it does a number of key attributes, right? It brings products faster to the market. We'll talk at the bottom about being better together. It creates new experiences. When we talk about composable healthcare network, we'll talk specifically around experiences. Customers don't necessarily mean patients. They don't necessarily mean members. Everyone on this call is a customer. Yes, it can be a very competitive advantage. Automation, just like a lot of products that manage process and data, is an asset. You build assets to sell in the market, whether it's to a service or directly end-to-end to a customer. So it is a competitive advantage. Operational performance, I think, is a given. Less work I have to do, the more time I get back, the more accurate it is, the less cycle time it is. And then, of course, it really attracts that best talent. One of the key features of automation, especially in a post-COVID world, is building that full stack employee. I do not have to give you the metrics on what's happening to our employee base right now as a result of COVID and our vaccine lineage right now, but know that a lot of organizations that are deploying a full-scale automation program are attracting best talent because they're finding more junior people to pick up automation, build automation, and learn the process that way than bringing someone in that's extremely senior and trying to back them into automation. It's kind of the reverse of what you normally see, to the point where a lot of my health organizations are even creating talent upskilling programs specifically for automation. So as I said, I haven't even talked about UiPath yet. Those are just resilient points of why RPA. So why UiPath and why we're 60% of the largest IDNs in the United States, as well as global health services, because we can see, think, and do. Like again, it's not just screen scraping. Robots are much more advanced than they used to be. If I can program it to see what I see, if I can program it to think the way I do, and then I can actually take that insight and take action, there's about 60% of those processes that your administration team touches on a daily basis that can be automated. And that's everything from IT all the way to clinical operations. And there's a couple intrinsic pieces here, right? For one, that gives you a digital scalable workforce. Scalable is the key. Think about a lot of your operations, your ICUs that are overburdened, back in administration doing revenue cycle management. They all go through peaks and valleys, sometimes daily, sometimes monthly, sometimes yearly. You can never predict them, at least you can try. When you bring automation into that spectrum, that scale flattens those curves for sure. Of course, a lot of people think automation is primarily used for the contact center. I don't disagree. It's heavily used in the contact center. But for us, it's used across the whole enterprise. I actually have a large IDN that's using robots at 47,000 employees' desktops today, including the robots that sit on the back end that work automagically. We talked about the think. It is cognitive, it is intelligent. When you build robots, you build that process, but a lot of the talk track today was about AI, machine learning, and the integration. I don't necessarily build those models for you, nor do I want to be the Amazon of the world. I want you to be able to take that product, embed it into my product seamlessly, and then have that robot act proactively, not reactively. We're in the business of healthcare, not sick care. Healthcare is being proactive. The third piece is exception management. We'll talk about engagement layers, which is kind of new to the world of automation. Engagement management tends to be at the BPM level. Your Pegas, your Facets, your Epics of the world, high-end UI with a workflow sitting on back and maybe some automation behind it. We flip that model and say automation first with the engagement layer to optimize those BPM products. And then the last piece is using intelligence to find those efficiencies in the process. Automation isn't just about robots, it's also about automating the data that's collected and then giving you results or blowback of what can be improved. So all of this is what UiPath delivers in our fully automated platform. Not my intent to go through all of it. Matter of fact, we just had our big major event a couple of weeks ago, and we announced another 483 capabilities. But know that everything that's on this page is really meant to either identify an opportunity to automate, gives you a way of fully automating it, whether it's a document, whether it's data, whether it's a full end-to-end process. Engage with it, which either is I'm going to let the robot run by itself, I'm going to interact with it, or I'm going to create almost a seamless desktop application to drive it. And then the last piece is managing it for quality control and testing it. Key thing here, and this is a lot of the questions I've been getting lately, is it cloud-based? Yes. Is it on-premise? Yes. Can I put it in Kubernetes? Yes. All possible as of our release that actually got announced today. So let's actually talk about composability here. This is going to look a little different than what we just covered in our conversation, because we saw those great metrics of why automation is key. This is a great graph that I lended from one of our banking partners that was showing what are the major spends and priorities of health systems. This isn't even 6 months old. The thing that immediately strikes you is that nice box over there, use of AI robots, 2%. For me, that initially was a panic. 2% of executives are saying they're not prioritizing the use of AI and robots, but you know what? It's misleading. 2% of executives have downplayed buying automation just to buy automation. Remember we talked about 2019? It was I'm going to buy automation and the shiny object. That's the vitality curve we always talk about, right? What we have seen though is the inverse, where it's actually a part of all those major transformations, going back to that initial conversation of that 83%. They're driving big improved supply chain. Automation has to be a part of it. Staffing and human capital transformation has to be a part of it. Revenue cycle management, it's the entryway for automation. 90% of my customers start there. It's a part of it. Workflow, COVID-19 recovery, business continuity, and clinical workflow. Automation is a part of it. Now, this might make a lot of sense to you, and you're probably seeing this, but there's some big challenges we had to overcome to actually reach this, and this is where the composability comes into. We move from task automation to process automation to long-running composable processes. That's a long thing to say, but let me break it down into a few components. One, bringing human into the loop, especially for compliant and controlled data, right? How do I now take something that has been typically regarded as a touchless automation and actually make it a part of my work cycle? That's sort of new. Two, can it actually speak the language of healthcare? We just heard Amazon talk about FHIR compliance, FHIR. Can it speak that language? Is it future ready? Can I make it interact with my different systems? And then the last one, with that, can I now incorporate APIs? Can I bridge interoperability? Is it all going to be about the UI automation? So these are big tricks that automation and UiPath had to overcome in the post-COVID world. And you saw the big wheel of technology. We knew we had the technology. The question is bringing it all together into one layer. So what I'm going to show you before we go into some understanding of the composability and how this comes together, I always like to throw a demonstration in, just for the fun of it, so you can see what I'm talking about. This is actually a utilization management validation station. And let me break this down for you so you understand what we're looking at. So initially in traditional automation, let's say it's about prior authorization scheduling, okay, or case management. What a lot of organizations would have done is they would have built an automation that takes it out of the case management system, preps it up, drops it into a workflow, and the automation was just the touchless handoffs between two systems. This really isn't transformative, right? What's transformative about a utilization management process is the ability to look at all that upfront work that a utilization management case manager, an ICR, would do, which is mainly aggregate data across multiple systems, do some research, look at the clinical data, do some determination, and then summarize all that data so I can do my real job, which is validate. So what you're going to see in this demonstration, as it relates to the composability that we just talked about, is a long-running workflow that does all this work in an automated way so that a human can now spend 80% of their time validating and not 80% of their time researching. And for time purposes, I'm just going to quickly run through this so you don't see the whole process. We'll share it afterwards for sure. But what you see in front of you is actually a robot running. Now, in this scenario, a new case comes through. This would all be done by a robot on the back end. You wouldn't have to do it. The robot's doing it naturally and running in a consecutive way, just like a human would, going through the different systems, taking the points of the authorization, probably from the 278, and then running through the process. Of course, you would not see this. I have to show it so you can see the demonstration. Pulling the medical details from the chart, grabbing the data, doing validation for CPT codes. These are all things that a researcher would do today in their various legacy systems. We show it here in websites, but you could have an internal director, which a lot of organizations do today. But let me fast forward a little bit to show you what the end output is. This is a composable long-running workflow. We call this Action Center. It's an exception management-based tool that allows robots to interact with humans when a case comes up. So all that research the robot just did, aggregated that within a format which is managed by the team. So it was designed based on the persona, and it pulls all that data into a format that they can easily read, like a validation. So in this example, as you go through, the experience would be, I have now my list of UMs to review. It's aggregated. I'll come through here based on priority, and all the data I would have otherwise researched is now here for me to look through. What's also interesting here, and this is kind of a rollover from the Amazon conversation we just talked about, we actually incorporated some medical NLP here. It could have been SageMaker. We used a different product. The point is, I don't focus on what product you should use. You focus on what product you can use. I ingest it into my application seamlessly when you build the robot. So through this, it's doing that extraction, pulling it in, doing the medical necessity. And now all this information is in front of me as a utilization manager, so I can make the validation. And then what's key here, and this is that human in the loop long-running process workflow. If I approve and accept, the robot just starts back over again, takes my approval, and then makes a submission in the case management system. So when we talk about composability and long-running workflow, this is really a vital concept as we approach healthcare in RPA 2.0. Let me show you what we just talked about and why this is important into composability. So one, it's a practical application layer. I'm not trying to sell you a BPM. I'm not trying to sell you new tools. It's practical. It's something you can deliver in weeks, not months, not years. Two, it speaks the language of healthcare. We used Fire in this example. We actually have a free Fire toolkit already built to do that extraction. So it speaks the language of healthcare in a compliant way. And the last piece, we saw NLP. It's able to take action on real-time insights. 63% of outcomes of an AI model are actionable by a robot, but typically aren't used that way today. So you actually saw it take action. So what does this mean to the whole composable world? So we talk about composability. And if you read the papers on Gartner, Composability is really that concept, which is integrating your whole health system without having to rebuild it from scratch, right? I probably summarize it in a really bad way, but I really appreciate the call to action they have, which is don't wait, transform with what you have now and evolve naturally so you can save that $1 trillion in expense you drive every year. And there was like really 4 things that they said were challenges that I think you start to see how this relates is 1, the situational awareness is limited. 2, information is not easily shared or exchanged. 3, operational intelligence is not actionable. And 4, workflow and business process are typically disconnected. And in our scenario, this is how automation is evolving. You saw that great human in the loop example, but there's a lot of other ways that this is being exercised right now to resolve the composable health network, right? So the situational awareness, right? I do have customers that have been able to take data directly out of their cloud environment. They do an analysis on sepsis control, and then the robot does all the front end and back end work and then makes a recommendation that's actionable for patients that have been flagged for quality control. Things aren't easily exchanged. We know that unilateral patient profile is always a problem, right? I have an HHS that had a cross-reconciliation issue across instances of Cerner. Cerner was great. They worked with us. They weren't quite sure how to fix it. So we just used robots to manage that across the instances, and it aggregated it every time a patient moved across HHS referral points. 3, operational intelligence is not actionable. You just saw it actionable. I have a great use case where I have a third-party administrator that took their pregnancy risk indication, machine learning, put it in my robot, deployed it at the physician end. Before the mother walks out of the office, they know if the mother is at risk and applicable for that case management program before they actually walk out of the appointment. Prior, it took almost 43 days to get that mother back in office. And then the 4th one, and the business processes are often disconnected, right? Great example, and I'll show you a really cool business case. I have a IDN that has a case management platform, very similar, and what they did is they had to do COVID outreach. They've got Epic, they've got Salesforce, and they've got an outbound Amazon dialer, a matter of fact. All 2 of them have an API, 1 of them don't. They don't all work together, and the actual high-paid clinician would have to stitch all that work together and make an outbound call like a white glove contact center agent. In this scenario, the robot pulled the demographics from the API from Epic, collated it with Salesforce to make sure that you were doing the right demographic outreach for contact center, organized it for the dialer, put it to the dialer, and then the dialer and its voice recognition did the outbound call and then the verification. And then if that person choose to talk to a care manager and a clinician, it would auto-populate all that data into the questionnaire so the physician didn't need to actually handhold this. There's a couple of great video demonstrations that we can share after this. I think we're going to cut close with a little time here.
Jason?
Yeah.
We're about 10 minutes beyond, so I need you to summarize.
Let me close it up. Yeah, let me just close it up with one thing here, Ron. I had a feeling we're coming right to the moment.
Yep.
But I just wanted to show kind of the outcome of this, and then maybe we could share this with the team afterwards, or they could pull up some of the video demonstrations.
Yep.
But proof's in the pudding, right? We talk about composability and clinical time saved. This is our insights dashboard, and this is the real dashboard from the client side they allowed us to use. 181,000 clinical hours saved when we were addressing composability in the health system with automation. To that business, that was $11 million in operational cost. Not divergent, no one was fired, but that was $11 million in translatable operational expense that they can now use in the business to reinvest in other technologies or other programs driving COVID today, like telehealth. So, very different view of composability and how leaders are thinking about automation today.